Hi, my name is Erica Keating, and welcome to Glowing Over 40. I've created this YouTube channel to get the word out about what life is like for me after 40, having two small kids right now. They are 3 and 7. After just having gone through a battle with breast cancer, juggling a 9 to 5 full-time corporate job and lifestyle. And I've recently signed up to become a Saint artist because I absolutely love and believe in this makeup. And I'm just over here living a crazy life, trying to live my best life, picking up the pieces after everything that happened to me in my cancer journey, and wanting to get the word out to other women, and hoping that you all don't feel alone out there too and isolated, especially if you're going through active treatment right now, or you're like me and you're just out of active treatment. You're trying to pick up the pieces and figure out who you are and where you're going from here. And so today's video, my first video on this channel, is about breast cancer awareness and breast cancer symptoms. I thought I would just share briefly my story in terms of how I found out I had cancer. I feel like this is a conversation that is had a lot, obviously, between people who are going through the battle, between survivors. People are curious too, and they ask this question all the time. But one thing that struck me as I was going through treatment was I actually got this question quite a lot from people who were on my care team, because they were going through their own struggle. I would always turn that question around and say, you know, why? What's going on with you? Is there something going on with you? And 9 times out of 10, there was, and it was with them. And they had maybe just found a lump and were just initiating the process of diagnostic testing, trying to figure out if it was cancer or not. Or some of them had gotten some inconclusive test results and they were watchfully waiting, and they were going to go back in a couple of months. And so really the reason that I decided to make this video today is because there is one symptom, a hallmark symptom, that never gets talked about or promoted among doctors and patients. You know, as a woman, as you're going to your annual exams your whole life, you know, your doctor is always doing that breast exam for you, right? As you're there, and they're encouraging you to do that exam, right? And it's all about feeling for lumps, feeling for lumps. Well, guess what? A lump may or may not be the first symptom that you have. It was not the first symptom that I had. And if I would have known about this symptom before and been educated, I would have been into the doctor's office on this journey, figuring it out, probably at least 4 months before I actually figured out that I had cancer, before I felt that lump. And so I have symptoms from the City of Hope website. I'm going to post a link to this at this video. But the one symptom that I really want to promote in this video is changes to the nipple. If I would have known that that was a symptom, I would have been into the doctor. And so let me just give you a quick overview of my story. In November, December of 2021, I distinctly remember it was during the holiday time, I noticed that my left breast wasn't behaving normally like my right breast. And what I mean by that is, when I would get the chills, all of our nipples get hard, right? Like, that's a normal behavior. Your body has that normal physiological reaction. Well, I noticed in passing that my left breast and nipple would not get hard when I would get the chills. My left breast stopped responding to temperature. The nipple just stopped behaving normally. And then after about a month or two, I noticed that my nipple was slightly sinking on one side. It was going inverted, which I've never had inverted nipples ever. And again, I noticed it, but I kind of didn't think much of it. Like it not getting hard, I just thought, oh, that's weird. And you know, I'm a busy mom, working full time. I've got 2 very demanding small children and lots of friends and family obligations and commitments. And so it was in one side of my brain and out the other, because I just didn't associate it with being a warning of anything. And then of course, in March, finally, of 2022, was when that lump right under the nipple became big enough for me to actually feel it. And that's what sent me to the doctor and sent me on the journey of the diagnostic testing, the mammogram, the ultrasound, the biopsy, and ultimately to the cancer diagnosis. And so I shout this from the rooftops when I talk to people about the cancer. I have shared this now that I'm back to work. I've shared it in safety moments with people, that This is a symptom. It's a telltale symptom. It's an important symptom. Doctors don't talk about it. And, if you are fortunate enough to feel a lump, wonderful. That's great. And that should absolutely send you into the doctor's office. But I've heard a lot of stories now. Some women have very large breasts, and these lumps can grow anywhere in the breast. And sometimes the lumps are so deep into the breast that you can't feel them from the outside. So you really need to be aware of the other symptoms also that will clue you in that, hey, something's wrong. Your body's trying to tell you something. God forbid it's cancer. So I'm just going to read off this list super quick. And I'm going to, again, post a link. So feeling a lump in the breast area with or without pain, changes in breast shape or size, a dimple or puckering in the breast, a nipple turning inward into the breast, nipple discharge other than breast milk, especially if it's bloody discharge, scaly red, darkened or swollen skin in the breast area, itchy scaly sores or rash on the nipple, a dimpled pitted appearance or feeling in the breast area, looking kind of like orange peel. And last but certainly not least, swollen or enlarged lymph nodes around the breast area, including the collarbone and the armpit area here. So again, I'm going to post this. Pay attention. It's not all always about lumps. Pay attention to those nipples. I would honestly encourage you that any change to your nipple, the way it looks, the way it feels, the way it sits, the way it behaves, the way it reacts to the environment, if anything changes, go see your doctor. Ask for the mammogram. That's my message today. I hope this reaches someone and can help them. Look forward to talking to you more on this channel. God bless you, be with you today, and we'll talk to you again soon.